Hi, this is Taylor Wrinkle, a UK nursing student, and today I'm going to be presenting on family-centered care in the pediatric patients. I'm doing my synthesis in the pediatric ICU at Kentucky Children's Hospital. This is a 12-bed unit, treats and monitors critically ill children, newborn to 18 years, with a variety of illnesses. Areas of specialty are acute respiratory failure, multi-system organ failure, neurological trauma, poisoning, post-operative management, and sepsis. Nurses care for 1 to 2 patients depending on the level of acuity. Majority of pediatric ICU admissions are unplanned, which is extremely stressful for families. I can't imagine the amount of stress the parents are going through while their child is hospitalized, especially if they are in the PICU. I can't imagine what it would be like seeing your child in the ICU and the uncertainty of your child's outcome. Walking into a high stimulus environment that is rapid pace, has multiple different noises or alarms going off, and constant bright lights. Hospitalization of a child is extremely stressful for both the patient and the family. During my synthesis, I quickly realized the importance of parental involvement as a part of the child's care in the PICU, which leads me to my topic. My topic is family-centered care. St. Jude's Children's Research Hospital describes family-centered care as the belief that healthcare staff and the family are partners working together to best meet the needs of the child. Family-centered care is a continual effort to be responsive to the needs and choices of each family. In the past, ICUs had major restrictions on visitation hours and did not allow multiple family members in the unit at once. Today, ICUs are shifting towards family-centered care, and many hospitals have changed their visitation policies to allow for continual parental presence. This new change has shown to best meet the needs of the child and resulted in positive outcomes. There are 4 core concepts of family-centered care. Number 1, dignity and respect. To listen and honor patient and family ideas and choices, and to use patient and family knowledge, values, beliefs, and cultural backgrounds to improve care planning and delivery. Number 2, information sharing. To communicate and share complete and unbiased information with patients and families in useful ways. Patients and families receive timely, complete, and accurate details so they can take part in care and decision making. Number 3, involvement. To encourage and support patients and families in care and decision making at the level they choose. Number 4, collaboration. To invite patients and family members to work together with healthcare staff to develop and evaluate policies and programs. Promoting family-centered care. Wheeler concluded that recognition that there is an opportunity to improve the quality of care provided to children and their family in a significant way, but understanding the importance of parents is a fundamental concept. It's important for nurses to practice family-centered care and understand the most common needs and stressors of parents in the PICU and ways to alleviate some of their stress. Nurses' perception of parental needs and stressors. It's important for nurses to ask the family about their individual needs and stressors so they can identify ways to decrease stress while in the PICU. Generally, nurses and parents have different perceptions about what is stressful and what interventions are helpful. Aldridge conducted a survey and found some nurses will recommend for parents to go home and rest, but many parents do not find this a helpful coping strategy. It's important for nurses not to assume they understand the parents' needs and stressors while they are in the PICU. It's important to recognize potential sources of parental stressors, such as alteration in the parental role, seeing the child in pain, being unable to care for the child, being unable to communicate with the child, not knowing how to help the child, uncertainty over the child's outcome, or unable to understand information. For example, not being present when a physician examines the child, receiving inconsistent information, not knowing how long the child will be in the hospital, not knowing what to expect, not knowing how life-threatening the child's illness is. The child's appearance, seeing the child with multiple tubes and IVs, child's behavior and emotions, their child being in pain and crying, procedures, being separated from their child during procedures, afraid for the results from the procedure, sights and sounds, the overwhelming stimuli in the PICU environment, financial stress, worried how they will pay for their child's care, taking off work while their child is in the hospital, or inconsistency in staff communication. Parent bed spaces are unique to the pediatric ICU. They promote family-centered care, and many new PICUs have provided parents' beds in the child's room. This decreases parental stress by allowing the parents to be with their child and provides continual parental presence. Smith conducted a survey using the parental stressor scale and found that parents reported decreased stress with parent bed spaces compared to parents without them. During my synthesis, I have seen parents choose to stay in their child's room and sleep in the parent bed spaces. Other parents choose to go home, and others request another room to sleep in away from their child. Parent bed spaces in the PICU are different than the adult ICUs and are used to decrease parental stress while their child is hospitalized. With that being said, it's important to realize that each family copes with stress differently, and some parents may not want to stay in the bed spaces provided in their child's room. Some parents reported the biggest stressor associated with the parent bed spaces in the new PICU environment was patient procedures in the room. Nurses need to be aware of this stressor and provide information regarding the procedure to the parents. Parents should be given the opportunity to stay or leave during the procedure. Another concept to consider with family-centered care is parental fatigue. Newer PICU units with parent bed spaces allow parents to stay with their child at all times, which may make them feel like they are expected to stay. It's important to remind parents to take a break and ensure their child will be continually monitored while they are gone. Nurses' role in parental fatigue. It's important for nurses to promote parent self-care. Smith stated, "Nurses need to be stressing the importance of caring for themselves so that they can continue to be available to support their child." Nurses can help decrease parental fatigue by assuring parents that they are not required or expected to continually stay with their child at all times. Reinforce to parents that their child is being monitored 24/7 and will be continually monitored even when they are not present. Encourage them to take breaks and take turns being in the unit with another parent or family member. Use curtains, decrease voice level, and dim lights to promote both parent and patient rest. In conclusion, it's important to remember that each child and each family is unique. Families have different personalities, life experiences, values, beliefs, education, and religious and cultural backgrounds. Care provided should be equal to all patients and flexible so that the needs and choices of families can be met. Open, honest communication between patients and their families and healthcare staff. Being willing to talk about the bad as well as the good is important for changing, improving, and developing best care practices and policies. This kind of clear communication emphasizes the patient's and family's healthcare experience. When families and patients understand their options, they are empowered to be involved in their child's care. By working together, families and staff are strengthened by their partnership and shared knowledge. This results in the highest quality of care. Thank you. This is the end of my presentation.